Hi everyone, good afternoon and welcome to this session which will be conducted today and tomorrow. So giving you an orientation, we are going to have 2 days of pathology discussion. Today also at 12 noon and tomorrow also the timing remains the same for day 2. And I felt that I met you a couple of times last week talking about all the confusion regarding NEET and NEXT and FMGE and so on and so forth. So I think it's time that you forget all the chaos that is happening because that will keep on happening with numerous notifications coming out. It's time that we get down to solving questions, which is known as thrive amidst chaos. When everything around you is breaking and shattering, but you have to go into that mode that you have to just focus on your studies and not focus on anything else that is happening around you, because whatever has to happen eventually will happen, and we don't have a control over it, right? So what we have a control over is to sit down and study, and that is what we are going to do, thriving amidst chaos, right? That is what I call it. So very good afternoon to everyone, and a quick a thumbs up or an okay signal in the live chat box so that we can get going, because I've got you a couple of questions which are medium to lengthy STEM, whether it is NEET or FMG or NEXT. This is something which is definitely a part of every exam pattern, and this is mainly to calm your nerves, to tell you that this is not going to have any impact on whichever pattern comes out. What you have to study for pathology primarily remains the same. So at the end of this session, I believe you guys are going to have a very calm, composed state of mind. I hope so. And on that note, let us get going. Perfect. Let's start with question number 1. And yes, Dr. Syed and others, this is also inclined in a manner that upcoming FMG July exam students can also attempt it. Try a few questions, you'll get to know on your own. Let's get going. Here you have a 10-year-old male patient who presents with history of recurrent infections, easy bruising and light sensitivity. On physical examination, there is fair skin, light colored hair and nystagmus. Lab investigations show prolonged bleeding time and the presence of large cytoplasmic granules in the blood cells. Genetic testing shows mutation in list, and I think most of us have given an answer. Which of the following normal processes are likely to be hampered? And that is option B. So now question number 1, which is to tell you that be it any exam in this country, if you are only focusing on the medicine aspect and you don't find out what is the underlying pathology behind it, you will not be able to solve the question. So why did all of you call it Chediak-Higashi? I will come back to this question. Let me just quickly, even if you would have put a little bit of common sense, the problem is in list gene. List matlab there is a problem in lysosome. Even by putting a little bit of common sense, you could have come to an answer. But yes, all of you are right. This is a case of Chediak-Higashi syndrome, and Chediak-Higashi syndrome is a problem in the lysosome formation. So you do understand that lysosome formation is going to be a part of every cell, from the brain to the blood cells to the skin. Every cell has lysosome. So if lysosome gene undergoes a defect, can we start answering what will happen? And you guys know what is the full form. Chediak-Higashi mnemonic is Chediak, right? So C stands for what? Patient will have CNS abnormalities. So mother will say that milestones mein problem hai, or maybe there is some kind of neurological problem leading to eye related abnormalities. There is a squint, there is nystagmus. So there are all neurological problems happening. Next, there is going to be hemorrhage. Guys, hemorrhage matlab which cells have a problem? Of course, platelets mein problem hai. Platelets have a problem, platelet defect. Now I'm going to ask you a question from medicine and patho-integrated. If platelets have a problem and patient is having lots of hemorrhage, lots of bleeding, which is the time that is going to be elevated? Platelet ke liye we have bleeding time. So that is also correlation that okay, platelet ka problem hai, so bleeding time will be elevated. What else? DI stands for decreased immunity. Patient will have lots and lots of infections. Very good. Patient is going to have lots of infections. Okay, now comes the real deal. What is this A? I can see in front of me the patient has albinism. Look at the color of his hair. Guys, this is classically described as, very good, many of you have answered it, silvery gray hair. So this is when the patient or the child is walking into your OPD, you will see eyebrows, hair, the skin color, everything is very light, silvery gray hair. And lastly, pathology mein kya dikhega? So with K, you have learned coarse granules. Can you see this cell has big dots inside it? Big dots. तो अब ये सब पढ़ लिया. Everything you have studied. CNS, hemorrhage, decreased immunity, albinism, coarse granules. Now find all of this in the question. Have a look at this, guys. Did your patient have repeated infections? So out of the mnemonic of Chediak, क्या मिला इसके अंदर? We found decreased immunity because patient had recurrent infections. Bruising means lot of hemorrhage, bleeding. So yeah, hemorrhage is also found, and hemorrhage hai to platelet problem. Bleeding time should have been elevated. Yes, there is a prolonged bleeding time, that is also mentioned. Okay, then the patient has CNS related. So are there any eye problems? Are there any problems related to the eyes? Yes, there is nystagmus noted. Is there any albinism problem? Yes, light colored hair and light colored skin is noted. And are there coarse granules? Every word was written. Now this should give you confidence. While you believe that jitna lengthy question hoga, my life is going to become more difficult. No, lengthier the question, your life is going to become easier. The only thing is start practicing so much that time management should not go wrong in the exam. So it's not about the more I will speak. I always say the more I speak, the more information I will give you. So more the examiner speaks, more the information he's going to give you. So the answer is going to be phagolysosome fusion problem because it is a list gene defect. Are we okay with this question? Can we go on to the next one? Let's take it up one by one. So question number 2 coming up your way. Here you go. There's a 5-year-old child who presents with high fever, cough, coryza, conjunctivitis. Classical triad of microbiology. Okay, a few days later, he has a rash which starts on the face and spreads to the trunk. Then there are also measles specific IgM antibodies. So the disease is very well mentioned. Biopsy of the skin lesion shows you something, ma'am. This is so simple. Measles to inhone bata diya. So starting off it was basically wasting my time. Measles specific antibodies hai. Now I just need to know that the cells are going to be Warthin-Finkelday. Now this I'm going to correlate with a little bit of micro medicine as well as pathology. First and foremost, what are these giant cells? These are Warthin-Finkelday giant cells. So very easy to learn. M for measles and M ka ulta is going to be W. So that is going to be Warthin-Finkelday giant cells. How did we identify it? Because when I zoom into these giant cells, I will be able to see, like this is one huge giant cell. We all know that we can see some dots. Nucleus ke andar, can everyone see? There's a nucleus and there's a dot inside it. So there are intranuclear and also intracytoplasmic inclusions. That is how you will identify these. There are intranuclear and intracytoplasmic inclusions noted. That is what is a Warthin-Finkelday giant cell of measles. How else will the question come? Ye multinucleated giant cell, answer to mil gaya. And guys, going forward, you just don't have to do question answer. You also have to look at the other options. I'll come to that. Pehle measles wala story finish off karte hain. What was written over here? This January FMGE exam had this question. The NEET March exam also had this question. What is written over here? The 3 C's. So please note, the first thing that happens in measles is going to be fever with 3 C's. Matlab cough, coryza, conjunctivitis. Right? Guys, stop asking that question. This is for every student. NEET, FMG, INI, next. Basically, this is for a medical curriculum student. Okay? Chalo, coming back. Now we have what? We have fever and 3 C's. Cough, coryza and conjunctivitis. After that, what is the next spots that happen? That is the Koplik spots, which happen on the buccal mucosa. And after that, what comes up is going to be the rash. And what do you study in pediatrics? Timeline bhi bata do, finish of the pediatrics. So basically the 10th day is going to have all this fever, cough, coryza. Kyun? Because incubation period of measles is going to be 10 days. Now recently this year only there was a question on incubation period. So incubation period is 10 days. 10 days pe there is fever and 3 C's. After that add 2. So on the 12th day we are going to have Koplik spots, and then add another 2 because on the 14th day we are going to have rash. So remember, there is fever, 3 C's, then Koplik and then rash. And guys, please note, rash ka bhi ek pattern hai which they have mentioned in the question. Again, a pediatrics question. I always say rash is like you throw a bucket of water on someone. Imagine it's holy time, you're throwing bucket of water on someone. So you will throw the bucket of water on the head. So where will the water go? Pehle the water will go behind the ears. Then it will go on the neck, then on the shoulder, then on the body. So top down approach. Look at this. It starts on the face. After that, it is gonna go to the trunk and the extremities. That's a classical rash pattern of measles that you have. So everything about measles when you're studying, why don't you guys tell me the vaccine also that we are going to have for measles, because I believe that we should finish off everything. So measles ka vaccine, ma'am, it's a part of MMR. Do we all agree? Measles, mumps, rubella, going a little bit into PSM, little bit into integrated, hai na? We can study everything. So tell me, MMR vaccine hota hai, ma'am, measles, mumps, rubella. So can you tell me the incubation periods of all these three diseases? And can you tell me in the vaccine, what is the strain? This is something I taught you in the last class also on YouTube that we conducted. Very good. Pehle to strain everyone has started telling me. Ma'am, it is Edmonston Zagreb strain. Exactly. How did you learn it? Edmonston Zagreb. Zagreb word will be written in the question. So please remember, for measles, you have to learn the Zagreb word. Very good. This is settled. What about mumps? Mumps is what is mumps? Mumps is, if you remember, mumps is a chota sa bacha, and that chota sa bacha is very cute little, very cute chubby kid. Why chubby? Because यहाँ पर भी parotid enlarged, यहाँ पर भी parotid enlarged. Parotid glands are enlarged. So he's a very cute little kid known as Jerry. That is how we call it. So this is known as Gerald Lynn strain. Mumps ka cute bachcha Jerry, and now we have the strain that is Jerry Lynn strain. For rubella, it's very simple, RA27/3, and we are settled. So at least we know what are the vaccine strains. That is a very famous question in PSM. One more question in PSM comes are the incubation periods. So I think for measles, I have already told you it is 10 days. 10 को थोड़ा सा लेंदी कर दो. So what do you think for mumps is it going to be, ma'am? 10 में से let us make a 9 out of it. So mumps is going to be 19 days. And now what is left? Horizontal line bacha hai. So for rubella, out of this 19, I can make a 14. So now we are left with 14 days. Remember, it is 10, then 19, then 14. 10, 19, 14. These are the incubation periods of MMR, and these are the vaccines of MMR. So coming back, these are possibly every question around measles at this point of time that they can give to you. ये वाला part तो हो गया. Measles and Wardenfink-Elde done. What are these other cells that have been shown? Should we discuss quickly the other options? ये भी खत्म करें. Let's make a table and finish off all the giant cells. The first one is in front of you. The image is there, the name is there. You will tell me the disease, you will tell me the feature by which you identified it. Okay, tell me. So yeah, here we have Langhans. Of this I won't ask you. Everyone in our country knows that Langhans giant cell is seen in TB. कैसे पता लगा? Because I saw this arrangement. I saw this horseshoe shape arrangement, and that is how I got to know that it is a Langhans giant cell. Simple, इसमें कोई problem नहीं है. Now we come to the third one. Wardenfink-Elde, ma'am, we have already seen. Wardenfink-Elde ulta means M, that is measles, and that is intranuclear plus intracytoplasmic. ये देख लिया. What is the one that is left? Two tones. Remember, two tone, the way you say it, बहुत गोल गोल sound आता है, round round sound. So this means how is the nuclear arrangement going to be? The nucleus is round like a wreath. Wreath matlab round. Round arrangement is gonna be seen. And now when you're thinking about everything to do with round, ma'am, two tone is round round. Nucleus is also round round. Matlab it is a golmatol kind of round round thing, right? It is a golmatol thing. Golmatol thing means something to do with golmatol fat. So fat means lipid disorders. Lipid disorders means xanthoma. So that is how you learn it. So please note, it is two tone, which is round, which is gonna be xanthoma, that is there. So now let me give you another indirect question. They gave you a lipidaceous disorder, right? Or they gave you this picture, round wala, or they gave you these three photos. Picture number 1, picture 2, picture 3. They said which of these is oil red O positive. So thoda sa common sense lagana. Oil red O means fat, and fat means this is the two-tone giant cell wala giant cell that you have, the golmatol. That is the one that is going to be oil red O positive. How indirectly they can link any question. At the end of the day, I want to say the same thing. The logic and the concept shall remain the same. How will they mix and match? How will they join the dots? Only that is going to differ. Okay, this question is done. Anything that is left? Langhans wala dekh liya, guys. Horseshoe. Two-tone also you've seen the round lipid wala. This Reed-Sternberg is left. I don't think anyone wants me to show you the Reed-Sternberg. You've seen it a million times. But definitely you want to revise quickly the two owl eyes that you have. So this is an owl eye. Which one is this? Number 1. Everyone knows. One is Reed-Sternberg owl eye, one is cytomegalovirus. Pehle wala batao. What is it? This is the cytomegalovirus, and the second one is the Reed-Sternberg cell. And how did you identify? This is gonna be color of the eyes. We are focusing on the eyes, color of the eyes. So if you have blue color eyes, that is cytomegalovirus. Look at this, the color of the eyes is blue. Whereas if you have pink color eyes, that is going to be the Reed-Sternberg cell, right? And identify, matlab ye bhi at the end of the day, patho has only two colors, na, ya to pink ya fir blue. So same way, one of the eyes is going to be blue and one of the eyes is going to be pink. So remember, cytomegalovirus. Cytomegalovirus. So megalo, if you look at men versus women who are broader, who are mega, who are taller and broader, तो men का favorite color blue. तो cytomegalovirus में blue आएगा. Whereas when you look at Reed and Sternberg, history में जाओगे तो Reed and Sternberg were two female scientists. Females का favorite color is gonna be पिंक. तो फीमेल वाले के साथ पिंक रखना है, मेगैलो मेन के साथ यू हैव टू कीप ब्लू. सो दिस इज समथिंग which you just have to learn. And these owl eyes, this came in again this year. If this comes again in the next exam, it will be a hat trick because it came in NEET PG, it came in FMG. If it comes in one more exam, it's up for a hat trick this year. Okay, chalo, this question is done. Easy बहुत कुछ हो गया. थोड़ा सा let's go into a little bit of trick, medicine, patho integrated. Let's read this. 55-year-old male presents to the clinic with symptoms of shortness of breath, fatigue, and exercise intolerance. Physical examination shows enlarged and globally hypokinetic heart. Globally is the catch. Echo confirms dilation of all cardiac chambers and a systolic dysfunction. Myocardial biopsy is performed. Examination reveals something over here. Which of the following is the most likely cause? I can see most of you have answered alcohol abuse. See, I did put a devil sign on that side because I knew what was coming up. Many of you have answered alcohol abuse, but I would also want to tell you that the answer over here, because they asked you the most likely in this situation, my answer is genetics. Now you need to understand the difference. पहले तो disease बताओ. As soon as they said dilation of all cardiac chambers, all 4 chambers, I started thinking of dilated cardiomyopathy. Okay, no, someone said hypertrophic. This is not at all hypertrophic. Hypertrophic बाद में पढ़ेंगे. This is लिखा है ना, dilation of all chambers. This is definitely dilated cardiomyopathy. So how many chambers are going to be dilated? All 4 chambers are going to be dilated. Now comes the real question, ma'am, what is the cause? See, ideally the cause is not known. Idiopathic. More than 50. Read Harrison, read medicine. More than 50% cases. Why this happened? Pata hi nahi. Good for us. We don't know the cause. We don't have to learn anything. But when the cause is known, then we have alcohol as one of the most common causes. So why did I not select alcohol in the previous question? Because in the previous question, I also wanted to select this as the option, but something else was given. And what is this appearance? Look at the nuclei. The nuclei have become something like a star. So you call this the ninja star appearance. This is known as ninja star appearance. And when I start seeing ninja star appearance, it is more suggestive of something genetic. And which is the genetic mutation that you see? That is why I selected genetic mutation. And the genetic mutation that you see is the titin gene mutation, right? So please remember, guys, firstly someone said that अल्कोहल हिस्ट्री होना चाहिए था. इतना सिंपल नहीं होगा. दे वोंट से ना 55-year-old chronic alcoholic patient and then you will select alcohol abuse into it. ऐसा क्वेश्चन आने लगा. So then everyone's gonna have a party in the exam. And even if it would have been written 55-year-old alcoholic patient, that gives you no right कि सिर्फ alcohol ही हो सकता है. Then that means nothing else in his life can be a problem. Only alcohol is the sole problem of his life. That is not the case. Look at the picture. They've given you a biopsy. When you start seeing these ninja star nucleus, the most likely diagnosis that you will think of is going to be the titin mutation. So in case this wouldn't have been given, chalo मान लेते हैं this was not given, biopsy नहीं हुआ, then they would have asked you the most common cause that you would suspect. I would have also suspected alcohol abuse. ठीक है? But now this picture was given, then what will I suspect? I will suspect titin gene or genetic alterations. Everyone's got this question right. There is no confusion. There's one more thing that I want to add on. Yeah. So coming to the next one, Dr. Alia, it's not A more than B. It is in this case genetic more than alcohol. ये photo नहीं होता, then it would have been alcohol more common over genetic. This should not have any confusion going forward. Chalo, over here I said all the 4 chambers are dilated. Let's do a twist in the story, and the twist in the story is that only this chamber is dilated. What is this? This is the left ventricle. Left ventricle only dilate hua, nothing else. What is this known as? Ma'am, this is looking like that octopus pot. Everyone agrees? Tacot thubo. Tacot thubo is nothing but the octopus trap. तभी इसका नाम रखा tacot thubo. The heart is looking like that gold globule kind of a thing, and that is known as, very good, broken heart syndrome. Broken heart syndrome, which of course all of us have had in the past 2 weeks thanks to so many notifications. But what is broken heart syndrome? A lot of emotional stress. A lot of emotional stress. So you will classically, इसमें क्या history आएगा? Some emotional stress that suddenly next was announced. Emotional stress, right? But an examiner will never give you that. He will give you some other emotional stress. There could be a history of a breakup. There could be some full drama of a family dispute, land dispute, property dispute mentioned. There could be an unfortunate death in the family. So some severe emotional stress will be mentioned, and that emotional stress will result in excess of catecholamines, right? And that will result in this Tacot-Thubo cardiomyopathy. So please note, if all the 4 chambers are dilated, so dilated sochna, but if only the left ventricle is dilated, then you're gonna think of Tacot-Thubo. Meanwhile, someone in between, when I was answering or when I was talking about this question, someone had answered hypertrophic cardiomyopathy. No, hypertrophic mein, guys, look at the age. The age will never, most of the times, the age is not a 55-60-year-old person. I've got that also in front of you. If you're thinking of hypertrophic cardiomyopathy, it will be sudden death in a young athlete. You will usually get a 19-year-old basketball, football, cricket, some kind of athlete player hoga jo sudden death hua, sudden collapse hua. History like someone is running a marathon. 20-year-old boy is running a marathon. While running the marathon, he collapses, he dies. Or a 20-year-old basketball player, cricket player, football player, that kind of history will be mentioned. Then I'll think of hypertrophic cardiomyopathy. One more point I want to tell you. Hypertrophy of what? Left atria, left ventricle, right atria, right ventricle, septum, wall. Kahan ka hypertrophy? Interventricular septum. So when they will give you, see, they will obviously give you echo ka report likha hoga, because they are going to give you lengthy questions. So they will say there's a 19-year-old basketball player who has suddenly collapsed. Then they will say the echo is showing you markedly thickened interventricular septum, another hint. And then you see this classical photo, which I don't think anyone wants the description, you know it. क्या दिख रहा है इस फोटो में? You can see the ventricle, left ventricle has become a banana shaped heart. So yes, when you start seeing a banana shaped heart, that is when you will say, acha, this is hypertrophic cardiomyopathy. One last thing, hypertrophic cardiomyopathy का जब भी हिस्ट्री आएगा, you will have to take the history of the patient's family also, because this is an autosomal dominant disorder. So one another, see, question will keep on becoming lengthy. They will say a similar history was seen in the father. Father also died at a very young age of 38 years or 40 years. So you will realize that, acha, this is running in the family. This boy has also collapsed at a very young age. Echo maybe I am seeing interventricular septum is thickened. Banana shaped heart is there. It's like writing a short note. Itna sab likha hoga, I will never ever have a doubt it is hypertrophic cardiomyopathy. Jab sab pad liya to finish off the last one also. Restrictive cardiomyopathy. Quickly answer. Restriction. Restriction matlab here the problem is going to be in the diastole. Here this is, now let me tell you, this is a diastolic dysfunction. And why has this happened, ma'am? Something is sitting in the heart. Agar ye heart hai, someone irritating person has come and sat inside the heart. The most common cause is amyloidosis. So now you all know na how the question will twist and turn. Acha, someone said fibrosis, agreed. Anyone coming and sitting in the heart. Fibrous tissue can come and sit in the heart. Someone in between said, ma'am, some cancer, bilkul, metastasis comes and sits in the heart. Koi bhi irritating person will come and sit in the heart, like amyloid, cancer, fibrosis. So same problem hoga. But the most common cause is gonna be amyloidosis. So how will they twist the question? They will say there is a person who has shown a diastolic dysfunction. On microscopy, there is something which is what? Stain positive. What is this going to be? अमाइलॉइड का स्टेन. तो कॉमन सेंस पैथो से रिलेशन करना है, सो दे विल हैव टू से अमाइलॉइड के लिए कॉन्गो रेड पॉजिटिविटी. सो दिस इज हाउ क्वेश्चंस आर गोना बी क्लब्ड अगेन एंड अगेन, ट्राइंग टू tell you the same point that by chance, it's something like examiner has given you 10 points. I won't remember 10 points. Now my mind cannot remember everything. So maybe I'll forget 2, 4, 6, but there will be one point that will click in my mind, and that will click if I've read everything in a wholesome, holistic manner. So by chance diastolic dysfunction bhul gaye, restrictive cardiomyopathy bhul gaye, but examiner had written there is something which is positive for Congo red. Ma'am आपकी class attend करी थी, every class we attended, तो Congo red और amyloid याद रह गया. So then we know that I'm answering amyloidosis. So even if you miss out on one point, you pick up your answer from the other. Okay, chalo, this is also settled. I think we can move on to the next question now, and here you go with the question, guys. Correct. There's a 55-year-old female who presents with abdominal pain and weight loss. Physical examination shows a palpable mass in the right upper quadrant. Radiographic imaging shows calcification within the pancreatic parenchyma. Okay, histological examination shows some basophilic calcium deposits surrounded by chronic inflammatory infiltrates, and which of the following type of calcification is that going to be there? Dr. Tana, yes, for the previous one you were right, old age ka history hoga. Okay, most of you are right. This is a case of classical dystrophic calcification. So first, let me just put out all the other things. Dystrophic versus metastatic. Again, coming to the point that it started off as a surgery question with pancreatitis and calcification, but it's ultimately come down to a pathology answer. Which type of calcification is asked? Firstly, they've given the beautiful color. Calcium ka kya color hota hai? Out of the pink and blue, of course, calcium color is blue. So that is written. Then they've mentioned something in the pancreatic parenchyma, and look at the history also that is there. This seems to be a case of pancreatic pathology. Now I know that when I'm talking about pancreatic and some kind of, let's assume some pancreatitis has occurred or some pancreatic tumor has occurred. So basically the tissue, is the tissue normal? Pancreas ka tissue normal rahega? No ma'am, the tissue is going to show you features of death. And whenever there are any features of death, the kind of calcification becomes dystrophic calcification. So my advice is that you should know the difference between dystrophic and metastatic. Every question will be settled. So two options. In both these calcifications, if I go to basic, you have to blame someone. Either you blame the tissue or you blame the blood. या तो टिश्यू का प्रॉब्लम है या ब्लड का प्रॉब्लम है. इन डिस्ट्रोफिक कैल्सिफिकेशन देयर इज अ टिश्यू प्रॉब्लम, देयर इज अ डेड एंड डीजेनरेशन इन द टिश्यू दैट हैज हैपेंड. दिस मीन्स मैम ब्लड में कैल्शियम बिल्कुल नॉर्मल. व्हाट आर द नॉर्मल कैल्शियम लेवल्स? नॉर्मल कैल्शियम लेवल्स आर 9 to 11. तो नॉर्मल वो सब नॉर्मल आएगा. ब्लड रिपोर्ट में कैल्शियम इज बिटवीन 9 to 11. Totally fine. The problem that is going to be there is going to be in the tissues. Whereas in metastatic, tissue का कोई problem नहीं है. Tissue is totally normal. All the tissues of the body are normal. It is the calcium levels which are elevated. They are above 11. 9 to 11 का range नहीं है. It is going to be above 11. So now I'm settled with that much of information that dystrophic select karna jab DDD, there is dead and degenerative tissue, and metastatic select karna when there is a problem in the blood. So here there was a problem in the tissue na guys. Tissue mein problem tha, pancreas mein problem tha. So obviously I will be selecting dystrophic. Let me give you one indirect history. If it would have been, let's assume, if it would have been a case of multiple myeloma matlab bony lytic lesions, bone will break. Bone break हो गया, bone break हुआ, this means there's going to be an elevation in calcium. Now what would you have marked? What would you have selected? So I'm waiting for your answers. Yes, perfect. Now it would have been a case of metastatic calcification, because over here we would have clearly had increase in calcium. So now we'll think of metastatic. Okay, what is, तो ये first option, second option हो गया. What is this next one? Psammoma bodies, and that is exactly what I've got to you over here. What is this picture given over here? This is the psammoma bodies. Firstly, psammoma bodies कहाँ fit करोगे guys? Dystrophic में या metastatic में? Ma'am, psammoma bodies we will be settling in dystrophic. Why? Because look at all the reasons of psammoma body. Look at all the reasons. Psammoma, ये जितना भी, whatever I'm going to write in PSM, everything are tumors. tumors matlab death. In tumors there is a lot of cell growth, a lot of death. So a lot of death that happens in tumors. So which calcification will it be? It will be dystrophic calcification. Everyone, very quickly you're going to fill up PSMM for me. This is something which is very juvenile information that you are giving me, kindergarten wala information. Jaldi se bata do. So P for what? Papillary carcinoma. Papillary carcinoma of anywhere in the body. Again and again I tell you, people think papillary carcinoma thyroid. No, not just thyroid. Brain, thyroid, lungs, endometrium, ovary, colon, kahin ka bhi papillary carcinoma chalega. Next we have some endocrine tumors. So we have prolactinoma. Next we have something called somatostatinoma. Somatostatinoma. Okay, next. Very famous question of gynae. Serous ovarian tumors. One more gynae point you will tell me. Agar serous ovarian tumors hai and they have given me samoma bodies, okay, they will ask me the tumor marker. What is the tumor marker of serous ovarian tumor that you should be knowing of? Yes? Perfect. So CA 125 kahin nahi jayega. This is how the question will come. There will be an ovarian tumor. They will not mention serous. They will say koi ovarian tumor hai which is showing you the presence of samoma bodies. Samoma bodies means serous ovarian tumor. So your tumor marker becomes CA 125. The other two M's are very simple. One is a brain tumor, that is meningioma, and the other one, the last one, is a lung tumor, that is mesothelioma, that is going to be there. I hope that is okay with everyone. Ye sab clear ho gaya. So coming back, samoma bodies ka bhi, and samoma bodies ka description dikhta kaisa hai, this to I don't want to tell you only. How many times will you study this? Ma'am, samoma bodies looks as a round onion skinning type of material, exactly what I'm seeing over here, so that everyone knows. Chalo, coming all the way back, all these topics are settled. Someone asked me regarding calciphylaxis. Calciphylaxis, first and foremost, is something which you will not see in the pancreas. Calciphylaxis is something which is a reaction to, देखो break करके देख लेते हैं ना. Calciphylaxis means calci for calcium, phylaxis जैसे anaphylaxis होता है ना, phylaxis means some reaction. So this is a calcium related reaction, and that calcium related reaction will usually affect the skin, that's one side, or many drugs can also cause calciphylaxis. So there are calcium supplements, there are calcium based phosphate binders. So this is mainly either drug related, or it is related to some supplements, or it is gonna mainly affect the skin. Pancreatic pathology is something which is not expected, right? Okay, so I think we are settled with this also. Ye wala question ho gaya. I hope we can move on to the next one, which no one is going to like, but you will have to answer it. Your very famous pedigree charts. I know we are in for something which is very traumatic, but we have to settle down, right? Chalo, coming forward, what is this, guys? There's a 25-year-old male patient with tall stature, long limbs, hypermobility of joints. Family history is also there, with his father and younger sister also exhibiting something similar. Echo shows aortic root dilatation. Now you need to tell me that which of the observed features or which of the following pedigree chart do you want to fit in? Yeah, so at least everyone's got the disease right. Okay, you are thinking of Marfan's. Okay, you are thinking of Marfan's. But then what if, for example, you are thinking of Marfan's, then what beyond it are you thinking of? Okay, Marfan's, you are saying, ma'am, autosomal dominant hota hai, and if you're thinking of autosomal dominant, then which of the ones that you have over here? Okay, tell me the option. Don't tell. Answer to mujhe bhi pata hai. It is Marfan's. Okay, many of you are saying this is a case of option D. I will start going by options that you are telling me, because I know this is the one that is most problematic for more students. Okay, this was a trick question. Many of you answered option D. Pehle to let me go back to the question. Question mein kya tha? Every feature, I also agree with you, is going for Marfan's. Because Marfan's may we have a person who has a very tall stature with long limbs and mobility of joints is there, and father may be hai, sister may be hai, so it is autosomal dominant. And what is gonna be one of the cardiac problems? Marfan mein agar dekho, Marfan mein there are two cardiac problems. M is going to be mitral valve prolapse, and A is going to be aortic problems. So either there's an aortic dilation or there is an aortic dissection. So aortic dilation was also mentioned over here. I also believe it is autosomal dominant. But many of you answered option D over here. Let me see the pedigree of option D. So here what you have is a mother. I can see a mother over here. And the mother has given the disease to how many children? The mother has given the disease to all her children. यहाँ पर तो कुछ और ही बन रहा है. This is going as mother to all. Then when this female became a mother, she has also given the disease to all her children. This has become mother to all. But when this boy became a father, he has given the disease to no one. See, none of his kids have the problem. Father to none. Guys, ये क्या बन रहा है? This is to becoming mitochondrial inheritance. Mother to all, father to none is mitochondria. Marfan's is not mitochondrial. So for all those who answered option D, you guys have, you know what you've done? You've done, अच्छा सब generations में कुछ हो रहा है, चलो autosomal dominant है. But you have only focused on the generation. You didn't focus on that mother to all and father to none. तो ये वाला option हो गया rule out. Some of you answered this, that is option C. इसमें क्या हो रहा है? I can see there is a male person, father has it, father के बाद only the sons are having it, and then after that the grandson is having it. So only all the male members, all the males of the family are having it. So this is going to be Y-linked. Again, Marfan's is not Y-linked, so this is also ruled out and this is also ruled out. C and D तो बिल्कुल नहीं था. Now let's go to option number B. ऑप्शन नंबर बी में तो आई रियलाइज एवरीथिंग इन द फैमिली वाज गोइंग बढ़िया. ये वाला जनरेशन, ये वाला जनरेशन, ये वाला जनरेशन, सब लोग खुश थे. एवरीवन वाज हैप्पी. सडनली दिस वन गर्ल ओवर हियर एंड दिस वन बॉय ओवर हियर हैव लैंडेड अप विद दिस डिजीज. कुछ ऐसे एकदम से रैंडमली पॉप अप हो गया. समथिंग रैंडमली हैज पॉप्ड अप ओवर हियर. सो देयर आर टू ऑप्शंस नाउ आई हैव. Anyone who wants to, this is not only a trick question, this is a very tricky option also. तो बताओ. So you are saying that ma'am, एक तो this could be gonadal mosaicism. Do we all remember what is gonadal mosaicism? What is gonadal mosaicism? Gonadal mosaicism, what I call gonadal mosaicism is going to be the pop-up disease. Pop-up मतलब family में सब लोग ठीक थे. Grandparents, great grandparents, parents सब लोग ठीक थे. Randomly one or two kids have popped up with the disease. That is one option. Other option is कि मैम इसमें only 3 generations are shown. What if great grandparents में से किसी के पास problem था? Let's assume कि great grandparents में someone had a problem. So can I say generations are being skipped? This could be autosomal recessive also. So right now I cannot comment because I don't know the full 10, 12 generations का history. If someone in the family ever had the disease and randomly the 4th generation has ended up having, किसी को था और अब हुआ है, that is autosomal recessive. But if no one in the family had ever, they say नहीं ma'am, till ever that we can remember, no one in our family ever had this disease. Randomly these 2 kids have ended up having the disease. That is gonna be gonadal mosaicism. So this is either way. You didn't have to put so much of brain into it because this is not what you're seeking. You are seeking autosomal dominant. So now when I see autosomal dominant, I want to ask you and I want you to break it into 2 words. When I say autosomal, do you expect any gender bias? Do you expect that only men will have it or only women will have it? No, there is no gender bias that is gonna be seen. So that is the meaning of autosomal. Let me see. Men will also have the disease. Bilkul, this is men having the disease, but over here I can see primarily men. So now here I'm a little worried, or primarily women having the disease. So यहाँ पर I can see a little bit of a gender bias if you look little carefully. But is it that all the women are having the disease? I can see a lot of women seem to be normal also. It's not that every possible woman in this story is having the disease. Now look at the generation. So there's no gender bias. Gender bias would have been something like this. Man, 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 man. Every man in the story is having the disease. Here it's not that. Every female, nahin, few of the females are having the disease. That is one concept. Now let me look at the next point, and that is generation. So you will say that all generations have to be affected. All generations have to be affected. That is why you will call it dominant. Ma'am, dominant means every generation is going to show you a problem. Okay, over here, this generation shows me a problem. This generation shows me a problem, but the parents are not showing me a problem. Is this looking like autosomal dominant, classical autosomal dominant? It is not. So ma'am, ideally I wouldn't have even selected this. Maybe with a question mark I would have selected this, and that is the answer, because this is the toughest question that I've got today, because this was not a question where you could look at the pedigree and come to an answer. This is a question where you had to rule out the pedigrees and come to an answer, and I'll tell you how. You couldn't have selected this because this was classical mitochondrial, mother to all, father to none. You couldn't have selected this because this is classical Y-linked, man, classical Y-linked. You can't select. You can't even select this because this is classical autosomal recessive. We cannot. The only majburi, the hard point here is, the only option that I'm left with is this. So now you will tell me that, ma'am, explain this. I've understood that, okay, this is autosomal dominant and that is the answer over here, but why are these parents not having it? Because now I want to tell you something known as, in autosomal dominant, there is a phenomena, and for 2 minutes, FMG students, don't listen. For 2 minutes, don't listen to this. Okay, there is something known as autosomal dominant showing you incomplete penetrance. Now, what is incomplete penetrance? Means that, for example, if I am teaching you, you are listening to me. So one thing is, you will come to me and say, ma'am, I attended your class. Means I have a question, I have given it to you, you have sat in my class, you attended my class. But does that always mean that you will understand every word of it? No. So, you know, many things are going into my ears, but everything is not going into my brain. And that is incomplete penetrance. Means the defective gene is going to be present. The defective gene is present, but will the person end up showing the disease signs and symptoms? No. See, everything is going into your ears, but will it always go and register into your brain? Nahi hoga. So maybe these parents have the gene. Were they carrying the gene? Were they having the problem in their body? Yes. But were they showing you all these signs and symptoms? They were not. So remember, this phenomena is seen with autosomal dominant only. This is not seen with any recessive or X-linked, Y-linked, nothing. This is only seen with autosomal dominant, which says that maybe you did get the gene from your grandparents, but you were that one lucky person who got the gene also, but did not show any signs and symptoms. So you never know that you are that one lucky person in the generation. So this was that one lucky set of parents who got the genes, but they didn't show you any symptoms. But their future generations, they were not as lucky as them. They got the gene, they ended up showing the different generational than different signs and symptoms. So like I said, ye wala question is exactly, I would say this question is incomplete penetrance. It's going into your ears, but how much of it is registering into your brain is a major question mark. So I would say this question is gonna be an incomplete penetrance question, because you will not, that is one, this question, why did I get you this question? You're already scared of pedigrees. Why did I scare you a little more? Because I wanted to give you the toughest example possible, that in the exam, you don't just have to pick out one option. Sometimes you will not be able to pick out one option, but at least start ruling out, na? For example, when you study, what do? How many of you are guilty that when you study, you pick up all the small topics and you'll say, okay, let me finish this chapter because it's only 20-minute chapter. Let me finish this one because it is only a 15-second chapter, or 15-second one topic. Chota things you tend to tick off. That gives you a lot of satisfaction, and then you will come to neoplasia, which is a 4-hour chapter, right? Same way, sometimes you have to do this in the exam also, that you are not understanding everything. So you start with options and start, acha, this is mitochondrial, rule out. This is Y-linked, rule out. This is pakka autosomal recessive, rule out. This I don't know, and this is the only option left. So this is the answer over here. So sometimes you have to go by ruling out, and trust me, as next NEET and clinical questions will come up, ruling out is going to be much more essential than striking that one correct answer. How many of you have ever solved a USMLE pattern wala question? So you must have seen in those USMLE pattern questions, they are very lengthy, and sometimes you realize they have 5 options. So you sometimes feel that, what should I do in order to come to an answer, because there are more than one answer. You have to select the best answer. So ruling out is another practice that I wanted you to do. So I think this is one thing, especially for pedigree going forward. Please guys, pedigree ke liye never select an answer. Rule out the other options. Whatever is left, that is going to be your answer over there. Okay, so pedigree ke liye ruling out is very important. So a lot of incomplete penetrance is done. Now let's go to complete penetrance. Let's make you select a question where you can answer it at ease and you get your confidence back in life. Okay, chalo, let's start. You have a young child over here. right? There is a 3-year-old child who presents with delayed milestones, ataxia, seizures, and a happy demeanor with frequent laughter. I think I've got my answer. Child exhibits developmental delay. There is speech abnormalities, microcephaly, prominent chin. Genetic testing shows a deletion on chromosome 15, which genetic cause is most likely to be observed. Most of you have started answering option D and B में confusion है, which is the usual confusion. Firstly, what did they say over here? They said that there is, look at the options. Again, let's try to rule out. When I say trisomy 21, everyone believes, is no doubt about it. It is Down syndrome. Down syndrome is not going to give you things like microcephaly and chromosome 15 jab mentioned tha. Why will I think of chromosome 21? That is not making any sense. So this is totally ruled out. What is this? Mutation of FMR gene. FMR gene is for Fragile X syndrome. Fragile X chromosome 15 का क्यों होगा? So Fragile X syndrome is, of course, this is also ruled out. I have only two options of chromosome 15 over here, B and D, and I believe that because all these things are mentioned, this is a case of happy puppets. Very good. Happy puppet, guys, you guys are perfectly correct. This is a case of Angelman. So what is the other disease that you have to know? There are two conditions. Angelman versus Prader-Willi. I've got you the options. I've got you option number 1, option number 2. If I would have given it to you as a theory, as an image-based question, out of 1 and 2, which is Angelman as per you? As per these two images, which one will you select as Angelman? So yes, the first one happens to be Prader-Willi and the second one happens to be Angelman. And what is the reason for selecting it so? Because I realize Prader-Willi is also chromosome number 15. Angelman is also chromosome number 15. Yes, this is settled. Okay, before I get into this, one more thing that is chromosome 15. Finish off the 15s now, please, for me. Chromosome 15 related, especially exam going students. If we have any FMG students in class, you have an exam in 15 days, you tell me. Chromosome 15 mein Prader-Willi syndrome, chromosome 15 mein Angelman syndrome, and just now before this we did a question. Marfan syndrome. Marfan syndrome is also going to be chromosome 15. In the genetics chapter, there is nothing more from 15. Prader-Willi, Angelman, Marfan's. That's it. Coming back. Now, I realize in both of these, I have chromosome 15. So, ma'am, how is it possible? Same chromosome, but two different diseases are happening? Because over here, I am talking about which gene? I am talking about SNORT gene. And in the next one, I am talking about UBE3A gene. कैसे याद करेंगे? So simple. SNORT gene is gonna be associated with Prader-Willi and UBE3A gene is gonna be associated with Angelman. So दोनों में chromosome 15, both of them have chromosome 15, but genes are different. SNORT P Prader-Willi, UBE3AA Angelman. Now, what is imprinted? What is deleted? Firstly, deleted ka matlab everyone knows what is deleted. Everyone knows deletion, cut it out. What is imprinting? Imprinting means silencing. Imprinting word is English of silencing. So now they just want to ask you that which gene. So for example, your SNORT gene. One SNORT has come from mother, one SNORT has come from father. So one of them you will switch off. That is okay. And one of them gets deleted. So remember what gets deleted in Prader-Willi. Many of you who've seen the classes earlier have answered for me. Prader-Willi Papa region deleted. Excellent. Yes, this is for FMG July also, Dr. Saurabh. Papa region DE deleted. So now you will never forget Papa deletion was a case of Prader-Willi. This means mother was imprinted. So if Papa deletion was Prader-Willi, mother's deletion is going to be Angelman. Coming back, this was a case of Angelman. How are you so sure this is a case of Angelman? Because frequent laughing is Angelman baby, happy puppets. And if this is a case of Angelman, so Prader-Willi was Papa deletion, Angelman is going to be mother's deletion, and that is how we get it. Is this okay for everyone? We will definitely get a question on this, and this is, I don't consider this as any other subject, although this is a pedia, medicine, path combo, but I believe that if you studied the patho part of it, you don't need to study any other subject. So if you want to finish it off, why don't you finish off the medicine part also? Whether you deal with Prader-Willi or you deal with Angelman, how are the clinical symptomatologies going to go? So both of them are going to have mental retardation. You will see in the question, the mother will say milestone ka problem hai, school grades are not very good. So there is a mental retardation. In Prader-Willi, you are going to have a short stature and obesity. Prader-Willi is going to have short stature and obesity. We always very, simply call it a chota mota bacha. That is what is Prader-Willi, right? That is going to be chota mota, means short stature and obesity. Angelman, yes, mothers are angels. Mothers wear saris. So now tell me, what is the full form? Did your patient have seizures? Did your patient have ataxia? Did your patient have mental retardation? And of course, inappropriate laughter. The patient will keep on laughing. That is the reason was referred to as happy puppets. That is what was mentioned as happy puppets. So what all did we say? Seizures, ataxia, retardation and inappropriate laughter. Coming back, someone said, what if ma'am inappropriate laughter was not there? You look at the other thing, na? Did you have seizures? Did you have ataxia? Did you have for retardation? Did they mention there is a delayed milestones? And then they mentioned chromosome 15. Even if by chance this laughter word was not mentioned, the other parts of the sari mnemonica mentioned, you can still come to an answer. But what I have seen in the past, from past experiences, this happy demeanor and this frequent laughter thing has to be present, because this is the buzzword of identifying Angelman, without which it's going to be quite a problem for many students. They're not going to be, they're mean, but they're not that mean also. So I think the answer over here is settled, and you guys have answered the previous options also. Okay, let's move forward to another question going here, and here you go guys with the next one. There's a 56-year-old, I think we've got just 10 minutes more of this class left and then we'll be done. There's a 56-year-old male patient who presents to the emergency department with a sudden increase in blood pressure and severe headache because of BP, of course. On physical examination, there is bilateral retinal hemorrhages and proteinuria. There is confusion, there is dizziness, and there is some picture that they have shown over here to you. Firstly, even if I don't know this picture, maybe you are like, ma'am, I have gone into the next mode and I don't give much importance to first and second year subjects because they are only 10% as mentioned. I don't want to study all of this. So these pictures are out of my domain, ma'am. I will only focus on final year subjects. So even if you look at the history that has been given, this is very, very evident of the fact that this is not most likely a case of atherosclerosis, because atherosclerosis means some lipid, some fatty, some atherosclerotic plaque history would have been given. That is easily ruled out. Now, when you're talking about, again, when you're talking about essential hypertension, hypertensive encephalopathy and malignant hypertension, these are the three hypertensive things that are given. Now, that is where you will definitely need the help, because if you realize how much of blood pressure, that is not given, but some of the features that are given, bilateral retinal hemorrhages, proteinuria, so there is retina involvement, there is kidney involvement, proteinuria occurring means we are definitely going into a case of malignant hypertension. Then of course there is involvement of confusion, there is dizziness. So all of these features to be seen are more likely with malignant hypertension. These are classical signs and symptoms of malignant hypertension. And then of course you cannot, even if you believe that you don't like the subject, you will have to read this subject, because you will realize that there is something going round and round which only malignant hypertension shows you. Neither will essential nor will NCEF show you. Only malignant hypertension will show you that round and round, and that is onion skin pattern. Onion skin, onion peel, whatever you want to call it. So that round and round is onion skinning, which is, onion skin to a layman term ho gaya na. Tell me the real word for it. What is the real word for it? This round and round is referred to as hyperplastic arteriolosclerosis. This is the one that is going round and round like this. So hyperplastic arteriolosclerosis is gonna be seen in malignant hypertension, which was the case over here. Whereas again, someone said, what will we see in the others? In the others, you won't see it. When you're dealing with the case of hepatic and hypertensive encephalopathy, this is not something that is going to show you classically problems. By the time hypertensive NCEF happens, that is when the brain starts showing you possible areas of infarcts. You don't see these blood vessel problems in the brain over there. So again, there are no distinct pathological findings that you see in hypertensive encephalopathy. Similarly, there is no detailed pathology analysis that you see in essential hypertension. These are all clinical representations. You will never want to do a biopsy to find out these conditions. But for malignant hypertension, definitely you will see this kind of pathology, microscopic appearance in the blood vessels. Acha, by chance someone asked me, what about benign hypertension? Yeah. Every hypertension does not show you microscopic appearances. See, at the end of the day, we are dealing with a medicine and pathology correlation. Some of the things you will pick up on your clinical representation, some you will pick up on your pathology representation, then you will club the reports. That is where integration comes. So for benign and malignant hypertension, we have well-defined pathologies. So benign hypertension में क्या लिखा है? Hyaline arteriolosclerosis. Hyaline मतलब pink. I think everyone can see that the blood vessel has become very pink. So if the blood vessel has started looking very pink all around, that is hyaline, that is benign hypertension. Whereas if the blood vessel has started showing you this onion skin, that is hyperplasia, that is malignant hypertension, and that is what was mentioned over here. So as I said, you like path or you don't like path, or you believe it is 10% or 20% of the next exam, you will have to study it and there's no escaping out of it. Can we move forward? Again, this is one last question, actually second last question that we have. This, if the FMG students want to skip, you can skip this. Second last question, 2 more left for the day, 5 minutes. So you can let me know. Dr. Nitin, that depends on which blood vessel, but very commonly this is found in the renal blood vessels, okay? Chalo, coming back, this FMG students want to take a skip, you can. The last question is going to be for you, so you can skip this if you wish to. You have a 60-year-old male who presents to the primary care physician with complaints of blood in the urine. Blood in the urine is hematuria, we know it. He denies any pain or discomfort during urination, and the patient has a history of smoking and exposure to industrial chemicals. Every word we are going to dissect. Answer to sabne batai diya, which is fine, but I know this is a classical case of urinary bladder cancer. But before that, I want to ask you, urinary bladder cancer, what are the classical points of urinary bladder carcinoma that they are going to ask you? Question number 1, why did they mention history of smoking? Is it associated with smoking? Yes, it is. Question number 2, what did they say? Exposure to industrial chemicals. Can you tell me which chemical, guys? Urinary bladder cancer. Something to do with benz. Ab kya hai? Is it benzene or is it benzidine? Now that is where the real deal comes. What are you going to select? There is benzidine exposure. Please be very clear on this. Aniline dyes, agreed, and benzidine, because if the examiner writes benzene versus the examiner writes benzidine, all this I'm telling you from surgery because it is important. Benzene is more in cases of blood cancers, AML, whereas when the examiner is writing benzidine, please remember you will think of bladder, urinary bladder cancer ka sochna. So don't ever get confused in this. Benzene is for AML and benzidine is gonna be for bladder. Okay, now let me see further. The physical examination is unremarkable. Urine analysis, of course, hematuria to hoga because it's bladder cancer. Cystoscopy shows a suspicious lesion. So suspicious tha, you didn't know is it really a cancer or not. So what staining did you do? You did a immunohistochemistry. What color does immunohistochemistry give you in pathology? It always gives you a brown color. So this is settled, and I can see a lot of CKs mentioned, and the answer over here is option B. So jaldi se let us make a table for this brown color stain, that is immunohistochemistry. CK stands for what? CK stands for cytokeratin. CK stands for cytokeratin. After you're done with this, I'll take you back to microbiology of bladder cancer also. Chalo, coming back, yeah, if both are positive, how have I written? If both the markers end up being positive, 7 also positive, 20 also positive, number 1 you are going to think of bladder, B for bladder cancer, and this can also be seen in ovarian cancers. Ovarian cancers can also show you this. So remember, we have B for bladder cancer, O for ovarian, and usually ovarian mucinous cancers can show you this presence over here. Okay, then you say that, ma'am, everything is negative. All negativity means CC means hepatocellular carcinoma, renal cell carcinoma, CC things. Okay, then other than that, small cell carcinoma that you have in the lungs, or you have squamous cell carcinoma that you have in the lungs. So you will say, ma'am, all these CC tumors, RCC, HCC, SCC, SCC is sub negative, negative. CC is all negative. Okay, then you're going to think of only 7 positive and only 20 positive. So you are going to divide your body above the colon, below the colon. Everything that comes above the colon is going to be 7 positive, and everything that comes in females. Ab वैसे सोचो, if I ask you breast cancer, females, more common in females, so breast cancer is going to come in 7 positivity. If I ask you something to do with anything above the colon, so if I ask you thyroid cancers, of course. If I ask you salivary gland cancers, so of course. If I ask you pancreatic cancers, or if I ask you endometrial, female ka cancer, endometrium, any other ovarian cancer, female stuff, ma'am, all female stuff and all above the colon stuff will be, someone said CD, nahi, we are not doing CD markers, we are doing CK markers, cytokeratin, okay, they are all CK7 positive. Anything below the colon, anything below the colon, and I have learnt it as CM20. CM20 means what? Colon cancer itself, colorectal cancer and Merkel cell cancer. Merkel cell cancer and colorectal cancer is 20 positive, so we learn it as CM20. Repeating once again, both positive, bladder and ovarian mucinous. All negative, CC tumors are negative. 7 are going to be everything above the colon and female related. 20 is going to be CM20, that is below the colon, Merkel cell, CM20 settled. This was a classical case of bladder cancer. Both positive, your answer is in front of you, 720. This is very, very important that you have. Dr. Mustafa, Paget's disease of the breast nowadays is showing you a lot of varied morphology, but there also 7 positivity is more commonly seen because Paget's disease breast female, so 7 positivity is more commonly noted. Okay, chalo, this is settled, this question, and one now all FMG students, if you were on any kind of 5-minute break, you come back and answer the third thing. When you're dealing with urinary bladder carcinoma, name one parasite in microbiology that you have. Right, name one parasite. So I hope you remember we had schistosoma hematobium, that also causes bladder cancer. Which bladder cancer? S for S, it can cause squamous cell carcinoma also, it can cause transitional cell carcinoma also. This is a very famous question. So remember, if they ask you smoking, yes. If they ask you chemical, benzidine. And if they ask you squamous cell wala has happened, which parasite? It is schistosoma. I hope we are settled with this question, because now we move to the last question of the day, which is for every exam pattern. All FMG students need to come back and now attempt this. There's a 2-year-old child and ophthalmology. Honestly, the first thing comes to my mind, everyone has got it. Comes to the parents, comes to the clinic with his parents due to a noticeable white reflection in the pupil of his eye. What is this known as? The red reflex is lost and there is a white reflection in the pupil of the eye. In ophthalmology, what is this condition known as? I think everyone knows. Okay, other than that, there is observed in certain lighting conditions. The child has occasional squinting and poor vision, and ophthalmology shows you the presence of a retinal tumor. Anyway, a child and a retinal tumor, only retinoblastoma comes to my mind. Then they did a genetic testing and there is a problem in a tumor suppressor gene, matlab retinoblastoma gene. All that they have asked you is the chromosomes. Okay, so before that, I think this white reflex is very, very common. That means that white reflection, this is leukocoria, right? I hope everyone remembers there is leukocoria that you need to remember for the white eye reflection that you see in kids of not just retinoblastoma, it is seen in a lot of other conditions. So the white eye reflection is something which is mentioned over here. Along with that, they have mentioned RB gene, so RB gene chromosome 13. So there are 2 tumor suppressor genes. Tumor suppressor genes में एक होता है P53, one is P53, one is RB gene. Both of them you have to know. Their chromosomes are important. P53 gene is known as policeman and RB gene is known as governor. They are 2 very important officials of our body. They are good people of our body is what I want to tell you. P53 is also a good person. RB gene is also a good person. And they are present on P53 is 17, P13. Continue from here. RB gene is 13 से continue 13Q14. Repeating, P53 gene is 17P13, and when you continue from here, it is 13Q14. So for RB gene, it is going to be chromosome 13. That is important. But I have a couple of other chromosomes. Should be quick because chromosomes you have to revise many times. Na? Last 1 minute. Okay, last 1 minute that you have, chromosome number 11. Chromosome 11 is what genes that they will ask you in the exam. Another bachon wala gene, Wilms tumor. So if they would have not given you this eye history, if they would have given you this bacha with a renal tumor history, that would have become Wilms tumor, and Wilms tumor would have been chromosome number 11. Okay, talking about chromosome 3, what is the syndrome where they say chromosome 3 gets deleted? Deletion 3p. Deletion 3p is going to be 1, 2, 3, 3 alphabets, VHL syndrome. VHL syndrome, ma'am, what history will be given that will tell me about VHL syndrome? One kidney tumor will be given. Which kidney tumor? Clear cell RCC. Clear cell RCC history will be given. So clear cell RCC, VHL, 3 alphabet, third chromosome is deleted. Lastly, coming to chromosome 6. For chromosome 6, I think we can make a table, chota sa table. What are the things regarding chromosome 6? I think 2 genes are very, very important. Everyone knows HLA, transplantation, HLA typing, that is present on chromosome 6. And everyone also knows HFE. HFE is what? Iron overload, hemochromatosis. Iron overload, hemochromatosis is also chromosome 6. HLA gene is also chromosome 6. So these two H and H genes are present on chromosome 6. Third wala 1, 2, 3 VHL syndrome. Wilms tumor is going to be chromosome 11, and 13 and 17 I've already told you for the policeman and RB. A quick review of important. And one more important gene that we have done today was chromosome 15. Remember, for chromosome 15, we settled down with 3 things, that is Prader-Willi, Angelman and Marfan. So yeah, that also seems to be settled. So this was a very, very simple question where it started off as a logical question, but it came down to a pure ratta question. You know the chromosome or fact based. You know it or you don't know it. That is what it comes down to. And that definitely puts an end to today's class. So I did not keep it very lengthy. Instead, I've divided this into 2 parts so that the remaining 15 questions we will be doing tomorrow at 12 o'clock, so that your attention time span is maintained and you don't have to sit for very long hours. So this is a midday break that I wanted to give to you guys in your sleep slumber, because now I hope you will get back to your studies with a little more calmness, with a little more compact mind process, that it's not as difficult as people have made it, that integrated questions will come and you know what is going to happen. But tomorrow, what do we have? Renal questions are going to be there, cardiac questions are going to be more. So that's a little brief overview for tomorrow's session with Himat also. Okay. Dr. Mustafa has a question. Where do we see HMB45 positivity? HMB45 positivity, Dr. Mustafa, is seen in a couple of things. What has to be known by everyone is M for M, that is melanoma. So melanoma is what you have to know, and what has to be known only by INI-CET aspirants. It is also positive in a set of tumors called picomas. Picomas mein kya aata hai? Lungs mein it is known as the sugar tumor. In kidney it is known as angiomyolipoma. So these are all rare tumors which belong to a family called picomas, and picomas in the lungs are known as sugar tumor, in the kidney are known as AML, and they are also HMB45 positive. Dr. Neha, I have taken note of that. I'll definitely make a table for all your chromosomes, so don't worry. Maybe in the last flashback session that we'll have for before the FMG exam, I'll put up a table of the chromosomes so that you can quickly revise. And limited set, like 10 or 12 most important chromosomes I'll definitely put up. Yeah, so on that note, guys, we have also introduced, I think I've already told you this in the last class, that a new question bank has been added for students who are wanting to solve the clinical questions. So your QBank has been updated. Also, we have got a new feature which is flip the question. In case you missed out on this feature, I think you are aware, where you can look at the same question in a one-liner format and the same question in a clinical format. So all these features have been added. In case you've not checked them out on the app, my advice is just have a look at it once, so that yeah, you can set settle to it. One last doubt, what type of calcification is Monkeyberg? Dr. Meenakshi, it is dystrophic calcification, because if you look at the full name, Monkeyberg's is nothing but a degeneration. The other name for Monkeyberg is degeneration. So degeneration means it is D for D, which calcification? Dystrophic calcification. Regarding the targets, I'll definitely start, give me some time guys, because right now the focus is a little more on the FMG students, but yeah, give me a week's time, I'll prepare it and I'll definitely start with all of it. Thank you so much for joining. See you all tomorrow for day 2, and that will also be at 12 noon. So thank you for joining. See you tomorrow.